Taiwan is an island located in East Asia, off the southeastern coast of mainland China, across the Taiwan Strait. It lies to the north of the Philippines and south of Japan, in the western Pacific Ocean. Taiwan's official name is the Republic of China. Taiwan is the same size as the Netherlands in terms of land mass, but its population is 23 million. This makes it more populous than about 3/4 of the world's nations. Taiwan is home to a predominantly Han Chinese population, but also to indigenous peoples and immigrants. In the 1600s, Dutch and Spanish colonizers came to Taiwan but were eventually driven out by General Zheng Zhenggong. Taiwan was annexed by the Qing dynasty in 1683, ceded to Japan in 1895, and became the seat of the Republic of China government in 1949 after their defeat in the Chinese Civil War. Over the decades, Taiwan transformed into a vibrant democracy and economic powerhouse, while its political status remains an issue in cross-state relations with China. Present, Taiwan is a rich and highly developed country, especially known for its information and communication technology industries. A range of mountains spans from the north to the south of the main island, with most of the country's main cities on the west side with a high-speed rail connecting them. Taiwan has a subtropical climate except for the south, which is tropical. Summers are hot and humid, while the winters are short and mild with snow only up in the mountains. Taiwan is a populous country but also an aging country. It is expected that by 2025, more than 20% will be aged 65 or above, making Taiwan a super-aged society. The size and age of the population calls for a good healthcare system and with that a good insurance system. This is why the national health insurance was launched in 1995, providing affordable and accessible insurance to all citizens. A central part in the Taiwanese healthcare system is the National Health Insurance Program. By law, every Taiwanese citizen has to be a part of this program. This system was implemented in 1995 and is well known for its amazing accessibility, high coverage, short waiting times, low costs, and a data bank to plan and oversee health services. The program was developed exceptionally quickly. In less than 10 years, a team of planners developed the system, and it only took 18 months before it was then implemented. As a result, the health insurance coverage increased massively, going from 57% to almost the entire population. The funding for the program comes from enrolled people, employers, and the government. In return, it provides coverage for most drugs and procedures, except for very advanced ones.
Taiwan National Health Insurance is a government management single-payer system in Taiwan, and Taiwanese like a patient, he just paid fixed few premium to the National Health Insurance administration. Then he or her will get the IC card that you see in the movies, and the IC take the IC card to the hospital, and just to pay a little money, he can get the medical service. And the medical center or hospital will expense the connection to the National Health Insurance Administration. Then the institute will payment for the expression. So the system starts from the 1995 and covering about 99% of Taiwanese population. It's near 22 million population in Taiwan.
Healthcare providers are paid through two main systems. The first system is the fee-for-service, where doctors are paid for the services they deliver. And the second is the floating point global budget. In the global budget, payers and providers collaborate to decide on the budget every year in the National Health Insurance Committee. The money from the global budget comes from the premiums paid by the insured people. A provider can gain points through the amount of their services, which is then converted into an amount of money. Outpatient services are usually rewarded with more points.
And I think another problem is the income. The income is, I think the problem is associated with the shortage of human resource, because there is a nationwide insurance system, so it's just handled by the government. So everything is just the government say yes and then say yes. So they can decide many things, including the cost of or how many money they want to pay for the healthcare system. So I think it's just a balance.
The amount of premium a person pays is based on which category they fall into. There are 6 categories in total. For the first 3 categories, the premium is based on their monthly income. The last 3 categories' premiums are based on the average premium in the first 3 categories. Category 4 and 5 contains people from low-income households, military conscripts, military students, inmates, and widows of deceased military personnel. For these groups, the government subsidizes their premiums. In 2024, their premium was calculated to be 2,160 new Taiwanese dollars, which is roughly 60 euros. The 6th category consists mostly of veterans who pay 60% of the premium and the rest is covered by the government. When a person is registered in the National Health Insurance Program, they get a National Health Insurance card. This is proof that you are insured. Every time a person visits a hospital or clinic, they need to present this card. The National Health Insurance calls it your health passport. The card serves as an identification pass and contains all the vital patient records. When you present the card, your medical information will be transferred to the doctor's computer, so they can see your records easily. There are many positive effects and benefits that are associated with Taiwan's national health insurance. First of all, Taiwan's health insurance system ensures universal coverage, which means that all of Taiwan's population is insured, providing equal coverage to all citizens from birth, regardless of age, financial status, or employment status. Groups of foreigners residing or working in Taiwan are also offered the same coverage. Taiwan's health insurance also covers a wide set of health services, from traditional Chinese medicine to Western medicine and preventive health services. These preventive services are carried out locally in community health centers. We spoke to Nurse Yang, who has been a head nurse for 10 years in such a community health center.
So what kind of services does the health center provide?
Oh, it's complicated. A lot of services
okay.
and for free.
Yeah.
Maybe some kind of the cancer of the screen, vaccine injection. 6 岁, 6 years before, all of the vaccine injection for free. And some kind of the prevention knowledge in a social 在社区里面做，那很多种不同的工作在做。It's a lot of work in the center. Yes.
Another benefit of the system is the easy accessibility of healthcare. Patients can visit general practitioners, specialists, and hospitals without needing any referrals. There are generally no waiting lists, and patients can choose to see a specialist whenever it suits them without lengthy waiting times.
Yeah, I think for people it's very, very convenient to go to a hospital just with a doctor, especially to visit a subspecial, because we, in our healthcare system, we do not have a gatekeeper. It means we do not have a general physicians. They need to assign a patient to any subspecial. Whenever a patient wants to see any subspecial, like a surgeon or cardiovascular surgeon, they can just go to his clinic and have an appointment and visit the doctor and discuss with the doctor directly. So the patient can solve his problem very, very quickly. I think if a patient needs operation, maybe he can receive operation just within 1 or 2 weeks. It's very, very fast.
Another big benefit of the system are the low costs. Due to the single payer model, Administrative costs are low in Taiwan, consisting of less than 1% of the total healthcare expenses. Healthcare services, medications, and treatments are all affordable, making high-quality care more accessible to all people.
Another advantage, I think, is for the poor people. They do not have the money, so they can just go to a hospital even they have a major disease, such as cancer or as organ failure. In Taiwan, we see a lot of motorcycle. For people, they have the higher risk, have a traffic accident because they need to walk. They just need to go outside and have their work, so they have a higher chance to have injury. Or for people, they need to drive a motorcycle rather than drive a car. Actually, drive car is more safe. To ride a motorcycle is more dangerous in Taiwan. Actually, I like this healthcare insurance system in my personal experience because I can just care the patient because I'm a trauma surgeon. So for me, it's very, very nice because I can just care the patient, did not to concern the money, to think about if the patient has no money to pay this healthcare. No, the insurance will cover it. So I can just do everything I want to do directly. Yeah, it's very, very nice for physicians.
All health data are collected by the Department of Health. The National Health Research Institutes also keep a database on all the collected health data, which is anonymous. This data is used for research purposes and is also used as a way to monitor policy effects.
So there are several advantages of the Taiwan National Health Insurance database. First, it contains extensive medical record and treatment historical and patient demographic, so it is a comprehensive data.
This system can be seen as an efficient way of using already known information for further research, creating opportunities for population-based research, which would be difficult to conduct otherwise. However, there are some disadvantages and challenges that come with it as well. There are issues surrounding the question of consent, as citizens currently don't have a say in inclusion in the database.
It's very popular. It's very popular and a very famous part of our healthcare system, the data. And so many physicians and so many researchers, they use this data to doing the research, the study, and publish a result. Even some they can publish in very good journal and a very good. It's very nice study. I think this is a good part of this data, but just like you say, some people just ask, I did not agree to use this data. How can you use the data for research?
Yeah, this is the privacy issue ongoing in Taiwan. Then for the government, they are prepared to get informed consent for every patient, but it's a huge, it's a huge issue. So we are not doing this right now, but we were doing this maybe years or 2 years later.
Another disadvantage caused by the national health insurance system is the large amount of patients. Because healthcare is easily accessible and cheap, patients tend to seek medical help frequently, even for minor illnesses. On average, patients visit outpatient departments 14 times per year per person. This means that physicians in busy hospitals can easily see 50 patients per morning, which forces doctors to work more efficiently. This results in short consultation times, with the average being only 5 minutes per patient.
The trip is a big issue for. We found that patients always just hospital shopping every day. Yeah. The most high record is one person, a female person. He visited the hospital in 1 year. The time is over 400 times. 1 year, over 400 times. So maybe he looked, go to a hospital and go to another clinic, just two times per day. So this is a big issue in Taiwan.
We cannot prohibit the patient. You cannot use the healthcare system because that's patient's right. Because I think it's the patient will overuse the healthcare system. Sometimes it comes from anxiety, or they did not feel safe. So if we want to decrease the patient's anxiety, you cannot just by telling you cannot do it, it did not work. Yeah, it's one of the disadvantage of this system. It's so convenient, so everybody can just use it.
Other disadvantages include the high demand work environment as a result of the high patient volume. Taiwanese doctors work longer hours compared to physicians in other countries, with an average of 59.8 hours per week compared to 49.6 hours per week for physicians in the USA. The high workload is also evident in the nurse-to-patient ratio, which is on average 1:4 in the USA, but 1:8.6 in Taiwan.
Yeah, it's totally right. But I think it's a general problem. Not even in Taiwan, it's a healthcare problem in all global. The first one is shortage of healthcare resource, especially for healthcare provider, including the nurse. Yeah, in this time we have a problem of shortage of nurse. So we need to shut down. So I think in this period, especially post-COVID-19, so many nurses just decide to quit from their job. So in this period, in this year, I heard there's so many hospitals who shut down their beds or shut down their operation to decrease the operation.
A lot of things we doing, so with a few staff, so it's not enough for my job. 就是工作量跟那个工作人力其实是不是很对等的。我们的护理人力其实蛮少的，就是只有这样子。
There are solutions possible to the problems faced by the Taiwanese National Health Insurance. Healthcare funding and staffing could be increased by the government allocating more funds to healthcare. This would aid in relieving overworked staff and helping large amounts of patients. Another option would be to implement stricter prescription and referral guidelines to combat polypharmacy and manage patient load. Education may also play a role in preventing patients from overusing healthcare services. Preventive care through public health campaigns and expanding telemedicine services can help reduce the burden on hospitals by addressing health issues earlier and enabling patients to consult doctors remotely, especially in rural areas. However, there is no simple answer. Any solutions that are possible are going to be very multifaceted and complicated.
Okay. It's a big question. I think it's a very complicated problem. So I think I cannot answer this question by a simple answer. Yeah, because I think it's a fight between the people and the government and the healthcare providers. Yeah, because the government they know they should raise the pay for the insurance, but they know if they raise the pay, the people will not vote them. Yeah, so maybe it's not just a medical problem. I think it's a political problem. Yeah, so it's not so easy. But so far, I think the system still can work. But everybody just talk about when the system will broken. Maybe in the future it may be broken if we did not fix the problem in the future. But actually, I think the system has its advantage. So I hope the system can keep working.